Here today is Dr. Kathleen Murphy, who will discuss how policy analysis and federal legislation can be reshaped to further advance health initiatives and infrastructures through the establishment of the Congressional Office. Welcome, Dr. Kathleen Murphy. She is a pediatric ICU physician at Valley Children's Healthcare and Hospital. Welcome.
Hi, good afternoon, everyone. Thank you so much, Cindy, for that lovely introduction. And I would like to start off where my colleague and friend Tanya Pacheco-Werner just left off, in that we need to rethink what is possible. And in doing so, we need to center health at the nexus of everything we do, particularly policymaking and especially on the federal level. As you've heard from all of these wonderful health policy and public health scholars today, a lot of the work is being done on the local and regional level. Great work. But where we've really failed is on the federal level. Our public health infrastructure, our legislation that doesn't really look at the health impact of legislation. We look at the fiscal impact, as Cindy just mentioned. So the concept that I would like to just introduce today is a concept of a Congressional Health Office that is basically the sister to the Congressional Budget Office. And the Congressional Budget Office, as you may know, scores all federal legislation policy on a numeric score, on a what does it cost or what does it save us. And you know, many of us in public health think that's wrong, that's not where we should start. Because if you don't have health, you don't have anything. And so we think that policy making ought to start with health and health impact. And the way to do that, as my colleague, my mentor actually, Dr. Keisha Pollock-Porter, who's an expert in health impact assessments, she and I wrote a concept paper that just happened to be published today in Health Affairs, outlining this concept and proposing what we think is possible. So 80% of our health, what determines our health, is not health care. It's those other so-called social determinants of health, where we live, the air and water around us, our education, our opportunities for advancement and economic opportunities. Those things, the laws that sort of craft those things really shape our opportunity to live a healthy, productive life. And we feel that we have to completely change the way we do policymaking to better reflect that, so that health equity can be at the center of that. And I think that as we have seen today with all the presentations, an area like ours really suffers because health equity is not being made the center of what we do, and so we fall behind. And I think this pandemic didn't create anything new, it just showed where the problems already were and how much worse they can be made by something like a pandemic. So I will end there so that we can go to questions. I know a lot of people probably have questions. We'll post the link to the Health Affairs article in the chat box or the question and answer box, and I would be happy to expand on anything further, but the concept is really just everyone should have the opportunity for health. Thank you all so much for being here. And this collaborative really shows how we can really leverage each other's work to get at health equity. Thank you.